either one of my kids.
Historically, people thought that when a teen gets pregnant in our community, that's for that teen and her circle, maybe her family and some friends to deal with. But teen pregnancy impacts everyone. It impacts us as a community, as a city, as a region, as a state. Milwaukee, unfortunately, has had chronic teen birth rate statistics. And there are a lot of good people in this community who have been working on it for some 20 to 30 years. But unfortunately, we haven't seen the drops that we wanted.
And before the If Truth Be Told report, I don't think we realized how serious the teen pregnancy problem in this community really was. And by recognizing that at the time we were number 2 on the list of cities in the United States with the highest incidence of births to teens, really helped bring on the fact we had a serious problem on our hands and needed to do something about it.
The reality is this: many of the young women we're talking about are already living below the poverty line. When they become parents at too young an age, it's very, very likely that that cycle of poverty is going to continue. One of our missions is to alleviate poverty. We can't do that if we don't focus very, very specifically and strategically on the issue of teen pregnancy.
Milwaukee is a city that's capable of anything, but sometimes doesn't believe in its own potential. So you've got to hang a big, huge target out there and say, go for it.
Our goal was to find something that was measurable and statistically significant over a span of a few years. And we decided 46% was the reduction. And we didn't get to that willy-nilly. We got to that because we said this would move Milwaukee out of the top 10. This would bring Milwaukee in line with other cities of similar size. And this would put us on the track to deal with teen pregnancy in a way that we could manage it.
He came back and said, the goal is 46% by 2015. And I said, Evan, when I set a goal, I was thinking 5 or 7%, 46%. And sure enough, he proved that we could do it. He showed the steps to get there, and we've been making progress against that goal ever since.
Okay, so I guess the biggest take-home point from that was that the 46% by 2015 would basically take them out of that top 10% of the nation's biggest cities with teen pregnancy. Obviously, with starting any campaign, there's going to be some challenges. So the first one, like I mentioned before, teen pregnancy was becoming just widely accepted in the area, so they had to figure out some kind of way to make these teens realize this isn't just the norm, this isn't just something you can do and not have any consequences for. Also, another challenge was that the city's public school system didn't have any kind of health and human growth development curriculum. Like, they didn't have a set-in-stone sexual education courses or anything like that to teach these teens about these issues. And also, past and present efforts to tackle teen pregnancy in that area had failed. So they kind of had to think out of the box and start new because obviously it hadn't worked in the past. So basically the way that they figured they were going to reduce the teen pregnancy rate in Milwaukee by 46% by 2015 was they just needed to focus on open, honest, and hard-hitting messages that address the issues contributing to these teenagers having children at an early age, and really engage the community for a continued period of time, not just, you know, campaign for a year kind of thing. They needed to continue keeping up with this and make sure that that teens were realizing this for the long haul.
And let's just re-emphasize that point too. You can see that that number, the year they started was 2006. So they were planning here an 8-9-year-long campaign. They were very realistic that they knew they couldn't reach that number in 1 year overnight. It was going to be a time. So this is a long-term campaign we're talking about here, and it's still ongoing. So
Exactly.
Sorry to interrupt you.
Oh, no, you're fine. So yeah, but no, now basically we're going to go on to research, and Missy's going to cover that for you guys.
Okay, what what research methods do you all think that United Way used to understand their targeted audience?
That's a great question.
Go ahead.
Maybe to go in and talk to some of the students at the public schools and stuff like that.
Yeah, that's correct. Of the many research methods, community discussions and focus groups were used to understand their targeted audience a little bit better. This campaign was widely successful because it used it gained from community-wide efforts. And these efforts attributed to the research and success, community-based organizations and teen serving agencies were used in interviews and discussion groups. As Jessica said, the United Way of Greater Milwaukee and the Department of Health used the Teen Pregnancy Prevention Oversight Committee and its subcommittee, which were comprised of leaders to represent sectors from public health, government, business, philanthropy, faith, and education. And like I said from the research question, community discussions and focus groups were used as a primary research method, but also opinion surveys examining youth behavior and analysis of public health data were used as secondary research methods. And during May of 2005 through February 2006, an 8-month extensive assessment was used to gauge information as why teen pregnancy became so critical and examine why it was left unanswered for so long. 58 teen serving Milwaukee agencies were, like I said, were reviewed and participated to kind of gauge more relevant and accurate information regarding teens. Listening sessions as well were utilized that gauged information from agency representatives, concerned parents and citizens and youth, just to base off their information from them solely. Also, statistical data, best practices, and prevention and peripheral issues such as sexual victimization, racial disparity, and unemployment were thoroughly analyzed. And research concluded that 41% of teens having children were a part of the perpetual cycle of poverty in Milwaukee. And that 41% was a main factor in driving the committees and their subcommittees review throughout the initiative. In total, more than 30 focus groups and listening sessions were tested were used to test creative concepts. The committees and subcommittees provided extensive evaluations, so were used so that perspectives from the diverse groups were taken into accommodation. Teen pregnancy is an alarming factor for economic and public health. As you can see, the orange mark is Milwaukee. Milwaukee is way above the curve for the United States and the state of Wisconsin's marks for teen pregnancies per 1,000. Sarah Brown from the National Prevention of Teen Pregnancy concluded that there are 3 predictors in determining if a child has a likelihood for growing up in poverty. These predictors were if the child was being born of a teen mother. Secondly, if the parents were unmarried when the teen was born. And thirdly, if the mother did not have a high school degree or GED. And with those factors, the likelihood of being born in poverty was 27% if one of the things happened, if one of the above happened, 42% if 2 of them happened, 64% if all 3 occurred, and 7% if none of them happened. So experiencing all 3 made a child's chances of being born in poverty 9 times greater than if it didn't happen. And some alarming statistics that we found with the greater Milwaukee youth in testing them with the national youth was they reported high school students ever having sexual intercourse in Milwaukee. And like I said, Milwaukee is way above the curve of the U.S. and state levels. Some more alarming statistics with that versus the youth when examining their behavior. Milwaukee youth are twice as likely to have had sex before the age of 13. Milwaukee high school students are twice as likely to have had 4 or more sexual partners. And Milwaukee youth are 50% more likely to become physically abused by a boyfriend or girlfriend. So as you see, these are very alarming statistics and why it prompted the initiative. And also, I don't know if you all remember from the video, they kind of gauged that they were going to look for other cities with similar demographic and size to Milwaukee, and they examined Baltimore, Boston, Charlotte, and Kansas City to gauge information for similar statistics.